And we're starting with a topic called anti-snake venom. It is called polyvalent anti-snake venom. Okay. So in this short lecture, we'll discuss the availability, the types of snakes involved, test dose, the indication to start anti-snake venom, the maximum dose, additional dose. So among availability, we should understand that in India, we have a polyvalent anti-snake venom, and that is available in most of the tertiary care setups. So the snakes covered are Indian cobra, common krait, Russell viper, so-scaled viper. These are the krait. You can see the hexagonal scales also. In all the cases, you should study the features. This is a cobra with the spectacles and a hood. So-scaled viper, there are diamond-shaped markings on the body. Okay, snakes looks, but in this video, we are not talking about snakes. We are discussing about the polyvalent anti-snake venom. So now we should understand that the dose required. So you should understand that each 1 ml of the anti-snake venom will neutralize 0.6 milligram of Russell viper venom and 0.6 milligram of Indian cobra venom and 0.4 milligram of common krait and so-scaled viper venom. Okay, so this calculation will give you the dose requirement. Next, the maximum amount of venom is injected by the Russell viper. Okay, that is 143 milligram. The Russell viper maximum 143 milligram. And on an average bite, there is 67 milligram of this venom is injected, 67 milligram. So to neutralize this 67 milligram, you need at least 10 vials. How? You should understand that in 10 ml, that is 1 vial. Okay. So here we should see, we must see that 1 ml will neutralize 0.6 milligram of Russell viper venom. Okay. So 10 ml will neutralize 66 milligram Russell viper venom. So similarly 100 ml will neutralize 60 milligram. So it's almost 60 milligram, that is 67 here. So it's required 100 ml, that is almost 10 vials are required. Similarly, in so-scaled viper, it requires 4 to 6 vials. In Indian cobra, it requires 10 to 15 vials. In common krait, 10 to 15 vials. Common krait and so-scaled viper, as we discussed here, common krait and so-scaled viper, it's 0.4 mg neutralization. Next, the maximum dose is mostly 25 to 30 vials. Okay, usually 10 vials are enough. 6 to 10 vials are enough. But sometimes we should, if the still the inflammation or systemic signs and symptoms persist, we give more vials. You should see that it should not be more than 30 as a dictum. If at all the patient require more vials, that means that patient is resistant to the ASV, or at that time we should give some blood products to the patient to counteract the coagulability, like fresh frozen plasma and FFP and cryoprecipitate. So what are the indications to start ASV? So if you see the features of local envenomation, you can see the markings, bite markings, and local envenomation. There will be redness, there will be pain, swelling, like that, around swelling and around the bite. The lymphadenopathy, there is a regional lymphadenopathy, blister formation, and bleeding sites. The systemic signs is coagulability, hypercoagulability, bleeding manifestation. There is conjunctival hemorrhages, epistasis, and hematuria. So the WHO recommends that a whole blood clotting time, that is we can do in a primary setup or a secondary setup. In a tertiary or the care, we can check the INR machines are there. So in 20 minutes whole blood clotting time, you can see here that we take a 2 ml of fresh blood in glass vessel, leave it undisturbed for 20 minutes. So if the blood is still liquid, it means it's incoagulable blood. So there is hypofibrinogenemia, so it's hemotoxic. So don't wait for the 20 minutes always. Take in between, after 10 minutes itself, you clinically you take some another fresh sample of 2 ml. So because some, if one may go wrong, one may go right, it may change, it can change. So we should be more of clinical than theoretical. Okay, so if the 20 minutes whole blood clotting time is positive, we should see, or the INR is more than 1.2 or 4 to 5 second above or more than the baseline cutoff. And if you see some neurological manifestations, like in cobra, krait, neurological manifestations are ptosis, respiratory paralysis. So in such cases, you just don't wait. You just, it's a decision. You start a anti-snake venom. Okay. um, whether a test dose is needed. Actually, there is no need of a test dose. There is no need of test dose actually. It's a simple waste of time. If you want to check that hypersensitivity by giving ASV as a test dose, it's a complement mediated. Okay, it's not immunoglobulin mediated. So will not be able to identify which is complement mediated or it's immunoglobulin. Cannot differentiate. So don't waste time by doing a test dose. If you find that there is a suspicious of venomation, just go for ASV whether pre-medication required or not. Routinely, it's not required, but in some patients there who suspected anaphylaxis, okay, we'll give injection adrenaline 0.2 to 0.3 ml subcutaneously prior to the administration of ASV, before administration. Okay, so the methods for giving ASV, there are two methods, push method and a dilution or infusion method. Okay, in push method, what you do, you know that this vial, this ASV vial, one vial has a dried powder form of snake venom anti-serum, and along with that we'll get a distilled water. So what we do is we mix the distilled water, dried plus distilled water. That is, here we can see distilled water, freeze dried powder. Just mix it and make a 8 like that. You move that vial so that it can mix easily. Dilute the drug so that the 10 ml vial will get 10 ml, one vial 10 ml. Okay, we have decided to give 100 ml, that is 10 vials. In push method, you start infusion at the rate of 1 to 2 ml per minute. That is, in 1 minute, we give 1 to 2 ml of anti-snake venom. So for 100 ml to give, it takes around 50 to 100 minutes to finish the complete infusion of the ASV. Okay. Next is a dilution method. In that, you just take a 250 ml NS and mix this whole ASV, or you take a 5% dextrose. Then you can give it over the 50 to 100 minutes. Whatever, the key point is whatever method you use within the stipulated time, that is 50 to 100 minutes, you should complete the anti-snake venom. Okay. Next is whether you need to repeat ASV. We told that 6 to 10 vials are enough in most cases. So you check after 1 hour. That is told that 50 to 100 minutes is for the first 10 vial. So after 1 hour, you check for the signs and symptoms. If still the patient has got hemodynamic instability, like bleeding still persists, or some neurological signs are still there, in such cases you do not wait. Okay, you do not wait for complete 60. That is 100 minutes. You just start another 10 more vials of ASV. Okay. But routinely after giving 10 vials of ASV, and if the patient is stable, all the symptoms, there is no signs or symptoms, all the doses, everything has resolved, you don't need to check the parameters, that is LFT, the PTINR, all those things, you don't need to check. You just wait for 6 hours, 4 to 6 hours, ideally 6 hours. And then repeat PTINR, APTT, fibrinogen. If the values are not normal only, then you give 10 more vials. So if everything is better, no need to check the parameters. Wait for 6 hours. In between, if any deterioration happens, you check the PTINR, APTT, and if that is not normal only, you give 10 more vials. Maybe if you check this PTINR, APTT, it will be deranged, but there will not be any symptoms or signs. Even though if it is deranged also, you should give that vials. Okay. If still signs of envenomation or bleeding, you give FFP of cryoprecipitate. You must understand that cryoprecipitate is 10 to 15 units of cryoprecipitate for every 2 to 3 units of FFP is sufficient to correct hemostasis. Okay. That is. Next, you should understand it's a decision. Okay, it's your decision, clinical decision, whether to give ASV or don't give ASV. If at all you give a ASV, if you have decided to give ASV, then don't waste time. That's very important. Because in case of cobra or neurotoxic venoms, if it get bind to the receptors, it will be difficult to take back. Okay. So in between, if anaphylaxis, you encounter some anaphylactic reaction, you temporarily stop this infusion and treat anaphylaxis. You know the treatment of anaphylaxis, adrenaline, 1 in 1000 dilution, and you can also give hydrocortisone. Okay, that is regarding ASB. Thank you.